Hello and good afternoon. Welcome everyone to this panel discussion on sustainability in healthcare. It's a great pleasure to be hosting you today. My name is Robert Metzger. I lead sustainability at Philips globally. Let me briefly introduce my fellow panelists and then kick off our discussion with a couple of introductory remarks. Let me start with Bob Biggio from Boston Medical Center. He's Senior Vice President and Chief Sustainability and Real Estate Officer. Welcome, Bob. We also have Dr. Reid Omary, who is the professor of radiology at the Vanderbilt University Medical Center. Hello, Reid. And of course, we have the pleasure of having Secretary of Health and Human Services from Massachusetts Executive Office for Health and Human Services with us, Kate Welch. Welcome. It's a great pleasure having you all on the panel today. Interesting questions, and you have very different backgrounds. So I'm looking forward to a good discussion. Let me start with Secretary Kate Welch, maybe from your perspective, and for Massachusetts in particular, how does climate change impact public health?
Hi, good afternoon, everyone, and thank you, Robert. I think the shorter answer is, how does climate change not affect public health? I think it affects it in probably every way you can think of, from respiratory illnesses to food security, to heat-related illnesses that tend to affect vulnerable population, elders, people with behavioral health challenges, waterborne diseases. We're seeing evidence of behavioral health challenges in children who are worried about the climate. I mean, there's no end to things that we should worry about that, and that's why it's so imperative that we take action. I also think that not only do we have to be ready to respond to the public health crisis, but we also need to make sure that our healthcare delivery systems and our human service delivery systems that care for the most vulnerable are ready in the event of climate change. So it's a major focus of the work across our secretariat and a major focus of the Healey Driscoll administration.
Thanks. May I say, Kate, that is a great bridge, and you are already addressing the adaptation in the healthcare systems. But maybe that's a nice bridge to read you also. As a radiologist and professor at Vanderbilt, why have healthcare systems been relatively slower in adopting sustainability than maybe other industries?
Yeah, it's actually in some ways it's counterintuitive, because you would think that the healthcare sector is in the business of healing and would understand that climate care is fundamentally healthcare. There's two main reasons. One is financial. Since the pandemic, the average operating margin of health systems has dropped dramatically, and you even have some really storied medical centers that are having difficulty making any operating margin. And so what goes with that is this constant focus on how do we become more efficient. And then the second problem is a staffing crisis. There's not enough healthcare professionals, and 2 in 3 nurses right now are burnt out. I can speak as a radiologist. Half of radiologists are burnt out, and a quarter of practicing physicians are clinically depressed. With that, there's limited bandwidth to think perhaps in creative ways, and to employ a planetary perspective. And I think we'll find from the discussion today that's actually counterproductive, because considering sustainable healthcare is actually a true opportunity to reduce expenses.
Which is, I think, a very nice bridge also to Bob, right? If you think about Boston Medical, it is really a safety net hospital. And as far as I know, consistently struggles also to achieve positive operating margins in these circumstances. But given these financial challenges, why do you still prioritize and invest in sustainability? How does this come together from your perspective, Bob?
Boston Medical Center was formed in 1996 by the merger of Boston City Hospital and Boston University Hospital. And if you go back to the original founding of Boston City Hospital in 1858, at that time, it was founded to help the underserved populations in the city of Boston to improve their health care. And, you know, the interesting thing is during that same time frame, Frederick Law Olmsted was beginning to envision the creation of the Emerald Necklace Parkland here in Boston. And his vision for that parkland was really in how it would improve the public health. It wasn't so much just about a park. It was about how that would improve the public health within an urban center such as the city of Boston. And specifically how it would improve those of the communities that were underserved, the poorer communities back at that time. And I think what's interesting about that is, as much as things have changed, they really stayed the same, right? Climate change is still having, and the environment is still having an undue impact on the underserved populations. And so in many ways, it was part of our mission back during our founding, and it's still essential to our mission today. So I don't think it's something we can ignore. I would also say it, frankly, over the last 10 years, we've learned that it is something that has actually helped us improve our operating margin. It is, really helped us financially in our performance, and not something that we see as, a hindrance to our financial performance.
No, that is great to hear, and I think also very inspiring. Maybe we can go into a couple of practical examples also. Something maybe, Kate, from your background and experience, also in the perspective that you have today, that you want to share.
Yeah, I want to underscore Bob's point that I think we will make the progress we need to make on sustainability and resilience when we see the climate imperatives as good business and a better way to operate. And until we can shift our thinking about that, it's going to be always one more thing, the unfunded mandate that government is famous for adding to not-for-profit organizations or to itself now that I'm in government. And so one of the things I'm really proud to serve, and work with Governor Healy and Lieutenant Governor Driscoll is they have recognized climate as an incredible imperative. They've laid out 3 priorities for their administration: equity, affordability, and competitiveness. And the climate agenda lines up against each one of these. There's a way for Massachusetts to lead in climate tech like we've led in life sciences. It's a way for businesses to be more competitive and more sustainable by coming to our state where their investments will be protected. And then finally, the environmental justice issues are known to everybody, but it really is fundamental to our equity agenda. In our secretariat, the work resides in the Department of Public Health, but part of my job, I think, as secretary is to elevate the conversation, not only to be thinking about, the specific health impacts, but looking at all our investments. We move 8 million people around the state every year for doctor's appointments or, for any reason. Like if that movement was done in an electric vehicle, think about what it could mean to that kind of impact on climate change. So, under the governor's leadership, we're looking across government at climate in all that we do. And I like to think of it as health in all that we do, because I think climate and health are so inextricably linked.
Thanks, Kate. So it shouldn't be just one more thing, but deeply embedded decision making, right? And then it can also contribute, like Bob was saying, to operational efficiencies, to streamlining processes, to delivering actually better care. So, and we will come back to that. Thanks. Maybe question to Reid. We spoke about this duality, right? And taking care of patients, but also in the context of planetary health. What is actually planetary health, and how should healthcare systems embrace it?
So, if we think about the what has happened with greenhouse gas emissions, with environmental waste, some of those terms have also become politicized. When we think about health, there's really everyone is for health, and when we look at the health of individual patients and the health of individual communities, and then look more broadly at the health of nations, that has traditionally fallen under what is called global health. Planetary health extends that concept, and it looks at the relationship of all living species and of the connection of geology and the atmosphere to the health of all of those species. And in many ways, it's a little bit like when we go back to Copernicus. It decentered the thought that it was obviously the sun that revolved around the Earth, and Copernicus shifted that thinking into realizing that we're not the center of everything. Planetary health extends the perspective that we're all connected, and that humans are one of the 2 million species, and that we have an opportunity when we think from a planetary perspective to benefit actually the health of humans and all species. We think about the medical education, and that has focused so much on human health. We will need over time to train all healthcare professionals, and having this mindset that the choices we make to care for our patients actually may also impact the outcomes outside of those patients. So it's really a frame shift, and once we make that shift, it becomes really obvious that we have so many more opportunities to benefit all.
It's a very systemic approach, right? Being a physicist myself, the Copernicus example appeals to me, but I think in the healthcare sector also, that should be appealing to practitioners. I think not just talking about a hip or a heart, but looking at the patient as a whole, right? So not just looking at human health and trying to solve that in isolation, but looking also in socioeconomic determinants or the environmental preconditions. I think that's probably also very closely how you think about population health management.
And Robert, I think even a way to hone in on this is with planetary health is to consider the planet as a patient. The planet is in fact our biggest patient. And once we do, oh my goodness, there's so many opportunities we have to make a difference collectively.
It's a very powerful way of articulating this. I think especially when you discuss with healthcare professionals and your peers, I can imagine. Maybe bringing that back to the other side of the hospital, so to say, to Bob also. You mentioned at the beginning already that thinking like this, taking your social responsibility, the role for society, and implementing sustainability has already brought you tangible benefits also. But if I may ask you to give some examples of what you are particularly proud of, and maybe also what you have seen work in practice and what you would advise others to consider.
So I think in order to make the progress that we've done here at BMC, one of the important things is to recognize that it is integral to the mission and the work we do, right? And so by doing that, we haven't treated sustainability like it's a separate initiative that's off to the side. It is integrated into the overall kind of strategy, the real estate strategy that supports the organization and our mission. And I think that has been critical to our success. I think what I'm most proud of is the way I've looked at the sustainability work is both through a financial sustainability and environmental sustainability, right? And from a financial perspective, the way I look at it is if we're able to improve the environment by doing the right thing, and we're able to improve the bottom line of the organization simultaneously, by improving the bottom line, we're creating new resources that the organization can then reinvest into improving access to care, right? Because ultimately, it's the underserved populations, the lower income populations that are most impacted by climate change. And they're most impacted by the increases in cost in healthcare as well. And so the more we can use those resources to increase access and solve both problems, to me, it's a win-win. And I think that's what I'm most proud of. It's not just that we've been green, it's that we've been able to do it in a way that also has opened up access and improved access to care for our patients.
And it's
Yeah,
go ahead.
I don't mean to interrupt, Bob, but do I say one more thing about access to capital and the capital markets and green bonds? And
Yeah,
sustainability.
I mean, it's one of the examples of how it's improved our bottom line, right? So we were the first hospital in the nation to do sustainability bonds and green bonds. And in both cases, despite us not being having a top bond rating, both cases, the bonds were oversold. And the last bond we did, we estimated we saved about $5 million because of the green bond designation. And again, that's money that has helped us. For instance, the net zero facility we opened at Brockton, it helped us be able to do projects like that. And those patients prior to a facility like that opening, would have been stuck in emergency rooms for weeks, unfortunately.
So it's expanding access.
I used to be the CEO of BMC, and I used to joke that we were a better energy credit or green credit than we were a healthcare credit. But it was really, it did open up opportunities. And I think that's part of the responsibility. And one of the things Governor Healy wants us to do is to think about ways for sectors to decarbonize that actually are accretive, that can open up opportunities. There are, the federal government is heavily invested in this. And one of my learnings as secretary is really the opportunity to amplify that across, as I said, across health and human services, but also to help people take that first step for their organization, which might be some support from the federal government or from the state government or from some interesting financing vehicle, as Bob just described. And I think it's taking that first step, because once you do that, the payoff is there. And we have to think big. It's a very big problem, and we have to think across sectors to solve it.
Yeah, and that reminds me of a good friend I have here in Europe who told me once, if you cannot solve a problem, try to make it bigger. So I think what he meant is enlarging the solution space, right? It's exactly also what you said. It's about considering the planetary boundary conditions will not effectively make life more complicated, but actually helps you to find better solutions, and in the end drives also better care delivery. Like the example that Bob you gave with the facility. You mentioned net zero facility just as a footnote in your story, and what you did with the green bonds. But maybe you want to give a couple of more sentences on what that actually means and how that came about. A net zero care facility. That's I think pretty inspiring.
Well, again, because we integrated our sustainability work into our real estate strategy, right? So the projects that we were doing were both aimed at improving our organization for the care of our patients in the city, but they were also geared towards improving the environment around us. And so, and that was evident in the projects we were doing. And so because of that, we were able to get designated, to be a green bond. The process of the first one was more or less, it was almost self-designation, I think, when we did the original green bond, but the sustainability bond that we did more recently, we had to get validated, I guess, based on the work that we were doing and the work that we were planning to do with the investment from the money that we're going to get from the bonds.
Thanks. Maybe any comments from Reed also? What does this do with staff engagement and, for instance, with patients from your perspective as a radiologist?
Yeah. So one of the key tenets is that for healthcare professionals, they really are looking for meaning in their work. And when we entered healthcare many years ago, someone at least of my age, there was more of there was a calling, and I think there was more opportunity to engage in the care of patients and spending time with that connection. As medicine itself has become much more, I'll say, automated, and the appointment times has shrunk, I think healthcare professionals across the board are considering what are ways that they can return to that meaning. And so we have the opportunity, for instance, anyone working at Boston Medical Center here has the opportunity to join a medical center and health system that cares deeply about sustainability. And I think that offers a competitive advantage for recruiting the top talent that cares about climate. And we know 25% of graduating college seniors view climate change as the #1 problem facing society. Well, those graduating seniors, when they're looking for jobs, where do they go? Well, do I want to be an environmental engineer? Do I want to go work in government? Might I try to contact Secretary Walsh's office and see if there's a place
Please do.
policy
Yeah.
for me? Might I go to law school and do environmental law? Can I do green energy? But as yet, we haven't had health systems be one of the choices that our college grads. I want to go into healthcare because I care about the planet. Is just that hasn't happened yet, but it will happen
Yeah,
as
exactly.
more and more centers become like Boston Medical Center and embed this. It becomes core of what a healthcare professional does. And we have the opportunity to change the meaning of PCP from a primary care provider to a planetary care provider. I think that's our unmet opportunity.
Great. And I would agree with that. So what would you say, maybe to all of you, young healthcare professionals are typically very engaged on the topic, also, as you said, right? But what would they look for in healthcare systems and in hospitals in their working environment? How would they judge whether this is an institution and a care provider that really does something and is on the way to drive change? Any reflection?
To me, it's what Bob said, which is that sustainability isn't sort of an afterthought or something you do after you envision the process, but that you build it in. I think that it comes back to my theme of what I've learned from Chief Melissa Hoffer, who's the first climate chief in the nation, I think at the state level, is really thinking about investments that are at scale to create change, and organizations that are, have a sign that says turn off your light or turn off your computer when you go home. They're trying, but they're not going to change the paradigm. They're not going to reduce carbon emissions. They're not going to make their environment safer for the patients that they're on earth to serve. And so it's really the opportunity to leverage cross-sector investment, federal dollars, private dollars. Think about, the hospital. Think about all the hospitals that are in harm's way in terms of climate. Think about when a tornado rolls through, rural communities and hospitals are shut down, as I'm sure that happens in Tennessee, or seawater rise in a city like Boston, or extremes of heat and cold. Everything we've seen that can really cripple a system. In Massachusetts, was it 2015, Bob, was the snow year and the T kept shutting down and people couldn't get to work. It's just, we have got to, these are all inextricably linked. I love the idea of planetary care provider, because really, if we don't take care of the planet, we won't be here. And I think the public health message is to convey that message in a way that brings sort of hope and enthusiasm to people, not fear and loathing, because the problem gets so big that people are like, oh, get away from me with that. And that's not our job. It's our job to, remind you of all the great advances that have improved the public's health. And now we need to make the same progress in climate tech so that we can improve the planet's health.
That might exactly be a reason to join the healthcare system, right? If you are understanding what impact the current healthcare systems have on planetary health. We didn't speak about it, but right, the emissions at a global level are larger than all airlines or shipping lines together in terms of CO2 emissions. In a city, typically hospitals have 2.5 the impact of any other average commercial buildings. So that
if the U.S. healthcare system were a country, it'd be the 7th largest emitter in the world. So, this is more than just nice to do. It's we have to do.
So if you want to do anything about climate change, you should probably be in healthcare.
That's where we need to go. That's where we need to go. That's That's the future. And I think the more we can share and share our learnings together. So what we heard from Secretary Walsh and from Bob was the opportunity to think creatively about what are new ways that we can connect with different sectors. So the notion of thinking about solar panels and how they might be embedded into fundamentally a care algorithm for patients that are being frequently seen. I think that's an example where when other institutions hear about that innovation, there's that moment of like, wow, we need to start doing that. We need to inspire more. What I would just say in a positive way is the
Yep.
jealousy of innovation, so that we can all
Yep.
try to grow together.
So that
Yeah,
goes beyond the energy efficient equipment, Bob, right? I think that really is about care delivery. I think you mentioned that, and also Kate, you mentioned that. So how do we organize healthcare? How do we avoid maybe overtreatment, or how can we make sure that the right people get the right care at the right point of care, and maybe out of hospital, in a way that helps to align clinical outcomes with better environmental outcomes. But open to hear your thoughts on that topic. Maybe Bob also.
well, I was going to say, I think it's really important that people understand that we're in a time of kind of unprecedented change, right? And I think a lot of people are sitting back in this industry and waiting for a playbook as to how this needs to get done. And you have to lead. You have to try some new things. And we will all make mistakes. And so, like Reed said, it's really important that we share our experiences, that we share both the wins and the mistakes we make. But what we can't do is sit back and just wait, for a playbook, as though, or wait for permission to get this work done. We have to keep moving forward. BMC has, we've been the first to do many things. Like we did the first green bond, right? We did the first cogen that was black start and islanding in the city, right? And those were risks that we took. And I think others have to step forward. We have to take those risks, because it's just too big of a problem to sit back and wait for someone else to solve.
Thanks.
The other thing I've learned from Bob is that the most green square foot is the one you don't build.
Exactly.
And I think there's a lot of, well, I'll do it right the next time. And many of us are in buildings that aren't right now. And I think the story of the hospital in Brockton was an empty nursing home that was repurposed. And I think with sustainability as a core design principle, not an afterthought. And I think that particularly in New England states, and I'd point to Europe, who has led the way with this, in cities that are much older than American cities can ever imagine being, where they have built in sustainability into castles and things that we don't have enough of here, or many of here. I think I think we have to really sort of challenge some of the conventional thinking that we'll be platinum LEED when we build our new hospital. Right now, today, we've got to fix our challenges today, and that the minor renovation problem is an opportunity for sustainability. Yep. And that's and we haven't built the workforce that knows how to do this. And so part of it really is not only engaging people in healthcare, which I applaud Reed's enthusiasm for this, but I think climate tech jobs are going to be really important in the future, just like tech jobs were 20 years ago and still are today, I would add. But so how do we as a state gain a competitive advantage in building companies and services where people can solve these problems? Because it's going to take a lot of brain power, it's going to take a lot of investment, and it's going to take a lot of guts, as Bob said, people making the first move.
It's also about capabilities, education, attracting and retaining talent, and so forth. But maybe that's a nice bridge to your, Kate, also. I wanted to fire off a last round of questions before we get to some really interesting questions that came also in from the audience. From your perspective, what would be needed from governments to really close the health equity gap and drive sustainability in healthcare at the same time? Is that a contradiction? Can it go together? How do you think about it?
I think it's absolutely not a contradiction. And I think it starts with preparedness. We know from the events that we've had in our country, that lower income communities are hit harder and recover and are slower to recover. So from an equity standpoint, our job as a Department of Public Health is to make sure that when there's a climate event in our state, that all of the communities in the state recover and that the resources are there for people to recover. We've had floods in farms that affected the food supply. We've had fires. We've had everything you can think of. So we've got to make sure that we are ready, because we have to be here to serve people. The second thing, and I think fundamental to equity, at BMC, people always talk about health as well. We flipped it and started talking about wealth as health. And I think the jobs that are going to come in this sector, Massachusetts has a lot of natural advantages, lots of colleges, lots of really smart people, it's a great place to raise your family, to worship who you want, to live with whom you want. This is a great place to build, climate tech, and those jobs have to be available to the low-income community residents who are most affected by climate change. And then finally, I think talking about our successes and making it clear to people that there is a way through this. And I think that, gaining the public's health, I think it'll be important to gain the public's trust to help restore the public's health. And I think that's the work that we need to do as government, because I think that's inextricably linked with our equity agenda.
Thanks so much, Kate. Very clear. None of this can, of course, be done alone or in isolation, right? So that would be my next question to read also. How do you reflect on the role and the importance of partnerships in this?
Partnerships are absolutely essential for tackling the the largest challenges of our times. And the United Nations has developed the sustainability development goals. The Sustainable Development Goals there's 17 of them, and these were developed back in 2015. And they include climate action and equality and addressing poverty and clean water and air. And the last of the goals is actually to form partnerships. And the understanding is that we, it's really easy for any citizen to say, oh, this should be in Secretary Walsh's bailiwick. This should be government. And then, we know that, especially when we look at the entire United States, looking to government to solve our problems isn't going to work as a sole actor. We can look at industry, and it's wonderful to have you here and your expertise and all of Philips supporting a sustainability agenda. But that's also insufficient. We need to also bring in all the nonprofits, and I think there's this opportunity. We were talking earlier, this concept of fundamentally all nations coming together. We need all sectors to come together and think of it most broadly as a commons. This isn't just a private, health is not just a private good. We have to recognize that it's also a public good. And the actions that we take together to benefit the climate, they benefit 8 billion living people right now, and then all the future generations. So we will never do this if we sit in our silos. We have to feel comfortable breaking those silos. Those silos are kind of saran wrap on us, and we've been taught to be comfortable in them. We need to unlearn that and realize that for every major initiative, who are the partners that are outside of us that we might want to bring on, and think of it as stakeholders.
Who needs a seat on the table to solve the problem, right? So I think you could argue that a lot of the challenges that we see today have arisen because we have been working in silos. So very clear. And I think that's also, Bob, what you recognize, the day-to-day work was medical, right? I think you will do a lot with partnerships. medical center is an ecosystem itself. Maybe a question to you. If there would be one thing about the healthcare industry that would help to accelerate and make hospitals more sustainable, what would it be? All the experience that you have in the field.
Well, again, I see a lot of this work as a kind of a double-edged sword. It's both a cost issue and an environmental issue. And so when I look at healthcare in the United States, we've created the most expensive healthcare system in the world, but we're not in even the top 50 in terms of patient outcomes. And so, a lot of the hospital facilities we're building today in this country they keep getting larger and larger for a multitude of reasons. But, much of it is driven by influences that are coming from outside of healthcare even, right? That not necessarily the care providers themselves. And so for me, as Kate said, I look at it as the greenest square foot is the square foot we'll never have to build. So I look at our square footage and how do we really maximize the usage of that square footage to shrink the size of our facilities, to both reduce their impact on the environment and to reduce their cost to the healthcare system so that we can free up resources to go directly to care for our patients and to keep our community healthy. And so I think one of the questions I saw in the chat was, had to do with, not every sustainability initiative will have a return on investment from a cash perspective. But to me, it does, if you look at it from a health perspective. And so that's why I always look at it with this double-edged sword, both on the healthcare cost side, how we can improve access to care and how we can improve the environment. Because to me, both are critically important if we want to really have the impact on our community that, the kind of original mission and vision of BMC and Boston City Hospital was founded with.
I think that's increasingly clear also from this conversation, right? That you cannot solve this in isolation, but they need to go hand in hand, the environmental impact and the social impact on site. Thanks. Maybe coming to indeed some questions already. Bob, you addressed one of them. Another one was how much thought is being given to encourage or engaging in circular economy with vendor supply chains? Anything that comes to your mind? Somebody wants to pick that up. Going circular with vendors. Is that something that you are aware of? That is.
I'm sorry, what was the question? I didn't quite hear it. I'm looking in the chat.
Yeah.
How much thought is being given to engaging in a circular economy with vendors in supply chains? So, for instance,
yeah, that's so-called scope 3. I think it was the hardest part of the sustainability mission. Bob, you want to take that?
Yeah, I mean, the impact we can have on the scope 3 is really demand, right? If we are going to demand that we buy products that are sustainable, then that will change the products that are available. And so, we're in the process now of really inventorying all of our scope 3 emissions and, beginning to think about how can we help change that through the demand. But again, we have to look at both sides of that sword every time on the cost side. And so we're weighing it, how we'll develop our strategy to do that as an organization. So.
And I think I would just point out on this that what we learned in COVID was reliance on one country as a supplier, thinking specifically of China and masks was bad business, in addition to being bad for the public's health, to say nothing of the emissions that it takes to get a mask from China to Minneapolis. But and so I think that, again, we have to reframe the sustainability question as a business and ultimately safety question.
Also about supply chain.
We needed redundant suppliers of certain materials, period, end of sentence. And also it took a global pandemic for us to learn it as a sector. I hope we don't have to learn it twice.
No, exactly. We need to appreciate these learnings also. Clear. And that means also, for instance, then changing the rules of procurement, right? So de-risking your supply chains, but also thinking about green procurement criteria, I hear you say, Bob, and using the purchasing power. That links to another question in the chat also. How do you build a business case for the medtech community to embed these principles in their new product development processes? I think procurement is definitely one of these elements. Let me just throw in that 70% of the impact of healthcare is outside of the hospital. So what you call scope 3, Kate, right? So 30% is in the hospitals, but 70% is outside the hospitals. So addressing the global supply chains and incentivizing the medtech community is, I think, an important part if you want to do something about reducing the environmental footprint.
Yeah, I mean,
yeah.
I was just gonna say, you know, in many cases for us to really change the materials that we're purchasing, right, of the demand side, the products that are available to us, it's going to take partnerships. I mean, you know, and we're going to have to work collaboratively with the suppliers of those to try and help them also, you know, find solutions to find more sustainable solutions to their products that they provide. It's not as simple as just, you know, demanding that, oh, you have to provide us something that's sustainable. It's going to be a collaborative effort that I think is going to require a lot of cross-industry collaboration, not just in healthcare. So,
but I don't want to turn the question to you, but I look at a company like Philips that has made significant investment in the space. I look at the rest of the world, particularly Western Europe, that has led the way from, you know, conduction stoves to where you know, to their supply chain, to how care is delivered and where it's delivered. I think there's a lot that we in the U.S. healthcare system can learn from the rest of the world, to Reid's point about this being a planetary challenge and opportunity.
Yeah, it's true. And one of the things that I may say from our side, there's something like science-based targets, right? We basically say how you reduce. When you reduce, you're extremely transparent about it. It does not only very limited amount of offsetting, basically. And then you have a long-term perspective towards 2030, 2035, 2040. And you can do this for your own operations, like we are operating carbon neutral globally since 2020, but you can also expand it to your supply chain. We have 15,000 bill of material suppliers, and we are working with them to get them also to adopt science-based targets, report, reduce in line with this maximum of 1.5 degrees centigrade global warming. So I think there's a lot of stuff that we can do, but in partnerships. Indeed, I mean, if the public procurement, if healthcare and hospitals, also care providers, think and articulate what you want, how you factor planetary health into the way how you deliver care, I think it makes it much easier for the med tech community also to organize themselves around it and help build the business case. So it can also create some pull.
And Robert, I wanted to say also, we have the opportunity to look at other sectors. You know, I just bought I've been using the same pair of running shoes for the last 20 years, the same manufacturer of running shoes. And every year I buy another one. And, you know, it's one thing if it's going to be, you know, something like Allbirds, which was, you know, designed from the beginning to be sustainable. But now you see in all the major running shoes, they'll tell you how much carbon, I can't believe this. And same thing in some of the non-dairy, you know, like oat milk products. So, you know, we think, oh, healthcare, like the highest tech, okay, yes, all that. But we take something as seemingly mundane as like a jug of milk or running shoes, and it actually has the carbon emissions. When are we going to get to the place where every medical product that is purchased shows that it becomes like, you know, the carbon is like the calorie
exactly.
So
exactly.
So we and
I think in a consistent manner, right? Well, of course we can do that, and it's called an environmental product passport. But if you want to purchase something, that you want to be able to compare it across vendors, so you need a standardization also. So again, I think that is where public procurement, government agency, regulators can help, but also I think hospitals talking to each other and standardizing this type of procurement criteria and driving it. I had another question from the chat that I found particularly intriguing also. How do sustainability programs interface with local and regional health departments? I have a feeling that might be something for you, Kate, or...
Yeah, no, I think that's actually a really good question. There's something in my prep on this, which really is, you know, how much of this is done, you know, locally, where local customs, norms, traditions, how people work and relate, and versus sort of top down, either from a state or from the federal government or through even global, global standards that we're all trying to meet. I do think that the local boards of public health could be important, trusted messengers around both the challenges and opportunities for climate change. That we have to. There's many places to put resources when you work in government, and we need people to trust the reality of what something that's pretty hard for people to wrap their heads around, is going to mean to their kids and their grandkids or themselves, even today or next summer, in a heat event. So how do we have people who say, oh, there's always been bad weather in New England, wait a minute, and it changes? How do we have people see the extremes of climate that we're seeing as part of a problem that we as human beings need to solve? And I think local boards of public health and local public officials, mayors, people who make a million decisions in the course of a day can help advance this cause. And how do we inform that? And I think it's the public health experts in our state and across the country who can tell the story in a way that people can hear it. That's really important. Just think about, it's not eradicated, but think about how prevalent smoking was in our culture. Watch an old episode of Mad Men, and then think about how nobody smokes in their office, nobody smokes on a plane. And so how do we use the same public health tried and true techniques to get this message across?
That's an excellent point, Kate. And I think healthcare providers, health professionals are trusted, right, throughout the times. And I trust my doctor with my life, so to say, right? And if my doctor knows about the dependence of my personal health or public health topics on climate change, then he may or she may be able to take position and advise me on what I can do. So one is transparency and trust in data. I think the other thing is also, as you say, pointing to tangible things that everybody of us can do to contribute in our daily lives, be a care professional or as an innovator or a technology expert or a decision maker or whatever. I think it's important to break that down to stuff that is tangible and that we can do in our daily lives. There were many more interesting questions. I'm afraid we will have to wrap up at some point in time. So I wanted to give you a chance to maybe do a last round tour de table, or last round the table, and then wrap this beautiful discussion up. So any take-home messages that you want to share with the audience, reflections?
Get started.
Yeah.
Good.
Yeah, I would just repeat, you can't sit back and wait. You have to lead.
No excuses.
Yeah, and I would say that perfection is the enemy here. Everything is a trade-off, and do not consider because there's a trade-off you shouldn't do anything. That's the situation we're in.
Don't get paralyzed and overanalyze, but get started. And it's a very clear message. Thanks to all of you. Let me just try to, maybe with 3 sentences also, to wrap it up. We touched on many topics. It was very inspiring. We talked about sustainability in healthcare. I think it became clear also that are really two sides of the same coin, right? Reid, you even spoke about planetary health, but human health and planetary health are intrinsically connected, independent on each other, actually. And it has also become clear that I think the healthcare sector is not only suffering from climate change, but also contributing to it with emissions and waste. At the same time, we spoke about how healthcare sector can learn from other industries, adopting best practices to move ahead. We talked about examples, what's already happening, which is very encouraging. And I think we also spoke about the trust the public, we as individuals also place into our doctors, care providers, nurses. So there is an opportunity also to inspire other sectors actually by moving ahead as healthcare providers and doing what we should be doing and need to be doing in collaboration to mobilize others and really keep this planet inhabitable, so to say, and not create additional burdens for the healthcare systems by fueling the global climate crisis. So very rich discussion, very different perspectives. I really want to thank you one more, Secretary Kate Welch, Bob Biagio, and Dr. Reid Ormery. Great pleasure having you today, and thanks for the great work that you're doing.
Thanks,
Have a good day.
everyone.
Great to
Robert.
be here. Thank you so much.
You too.
Thank you.
Bye.